Good afternoon, everyone. So let's imagine a 40-year-old person who's seemingly healthy. He's a seemingly healthy individual and suddenly feels excruciating abdominal pain, which gets him into the emergency room. This person then diagnosed with acute pancreatitis, and surprisingly, his everyday lifestyle choices played a crucial role in developing this condition. So our research is focusing exactly on this, the role of lifestyle factors in the acute pancreatitis. My name is Benedek Kasza, and I'm a biotechnologist in the Institute for Translational Medicine page. My vision is to have improved outcome in pancreatic diseases by a multi-faceted lifestyle approach. And my mission is to identify major lifestyle risk factors to create preventive recommendations. So we started 2 projects, both of them focusing on lifestyle-related risk factors and the incidence of acute pancreatitis. So let me go further with our first project, which is investigating the effects of modifiable lifestyle factors on the incidence of acute pancreatitis, which is a systematic review and meta-analysis. Acute pancreatitis is a sudden inflammation of the pancreas, and it can be severe, and unfortunately 8% of these cases progresses into chronic pancreatitis. This is a globally significant health issue because of its high incidence rate, and the rate is increasing. And what is concerning is that there is no specific evidence-based lifestyle recommendations to lower this risk. Therefore, it highlights the urgent need for lifestyle guidance. Our aim is to investigate how lifestyle factors influence the acute pancreatitis incidence. So we came up with the clinical question: how modifiable lifestyle factors, lifestyle-related risk factors affect the incidence of acute pancreatitis? We use the PO framework, where the population are human adults, and we have 6 exposures, like toxic agents, physical activity, BMI, nutrition, mental status, and socioeconomic parameters. And our outcome is the incidence of acute pancreatitis. Our hypothesis is that modifiable lifestyle-related risk factors have a different magnitudes of associations with the AP development. Our clinical implication is to find the most important modifiable lifestyle risk factors and eliminate them to decrease the AP incidence. Our key articles as strengths are using strong methods and working with high number of participants, but they also have limitations because the AP severity is not revised with the Atlanta guideline and only investigates a few or just one factor that we are looking for. So we build up a search key, which consists of 3 domains. The first domain is for the aspects of the condition. The second domain is for pancreatitis. And the third domain is for the epidemiology. We conducted the search in 3 databases, PubMed, Embase, and Cochrane. And we got more than 35,000 articles. And after the duplicate removal, we still have more than 27,000. It's a high number, we know. But our topic is feasible. It's registered in Prospero. We did the duplicate removal, and now we are on the title abstract phase. But we know we have to keep up the good work and the hard work to go further with the progress. So this was about the first project. So let me go with the second one. which is investigating the correlation between the incidence of lifestyle factors and the incidence of acute pancreatitis in European countries. This one is a Eurostat analysis. The incidence of acute pancreatitis varies in Europe from 4 to 100 per 100,000 people annually. And there's lifestyle factors which contribute to the development of this condition, like smoking and alcohol consumption, but also physical health has a major role. In Europe, the adults, 20% of the adults are obese, and 65% of the European adults are not reaching the recommended activity levels, which is a very high number. Also, in lower income countries, the incidence of acute pancreatitis is higher, and people who have depression are more likely to have unhealthy behaviors like smoking and drinking alcohol. So in this case, our clinical question is, how do specific lifestyle factors correlate with the incidence of acute pancreatitis in European countries? We use the same PO framework, where the population and the exposures and the outcome is the same. And our hypothesis now is that incidence of lifestyle factors correlate with the incidence of acute pancreatitis. The clinical implication is same as the one of the meta-analyses, but in this case, we are using a different method to investigate further the question and to provide a stronger conclusion. We are planning to investigate the presence of the mentioned exposures with the analysis of questionnaires from the Eurostat database, what you can see in this slide. So all in all, we have 2 ongoing projects, both of them focusing on the lifestyle-related risk factors and the incidence of acute pancreatitis, and we are planning to submit them in the next year. So I would like to thank you for your attention with the words of Hippocrates: the greatest medicine of all is to teach people how not to need it. Thank you.
It's a very small question. I think it's a little misleading. You are telling the drug use. What do you define, what exactly you're trying to tell here? Is it substance use or medications too?
Oh, it's substance use, it's not medications.
So you are only substance use?
Yes.
So I think you want to clarify that, because you're going there, substance use, you had a slide there. You're telling about alcohol and smoking too.
Yes, yes, yes.
But if you're telling that in a broad sense, the substance use can be heroin, et cetera, et cetera, et cetera. So you may want to clarify that part.
Okay, thank you.
I have a question. Maybe I'm lack of knowledge, but you wrote that glucose is, you want to measure glucose in acute pancreatitis, but high glucose intake, yeah, it's not healthy, but I don't have the knowledge that it would cause acute pancreatitis.
It's not exactly a cause, but it can be a risk factor beside more factors. So if we are examining that how acute pancreatitis cases and their glucose levels, then maybe we can find a correlation between it.
Yeah, but I think you have to a little bit more specify how you want to measure the increased glucose intake and the correlation with acute pancreatitis, because it's, at least for me, it's not clear enough.
Yes, thank you.
It's definitely not amongst the risk factors, the high sugar intake. But the diabetes, it's amongst the risk factors, so you are quite right that it needs to be also clarified.
Thank you for your presentation. It's similar to the previous question. What are the confounding variables that you think are you will need to look at in your meta-analysis?
What do you mean by that?
Confounding variables would be something like sex or age that may result to look like an effect, but it's not the effect, it's something else.
We are not looking like this. We are looking only patients with the first acute pancreatitis, but we are excluding anyone who has had previous one, or chronic pancreatitis, or pancreatic cancer.
Do you not collect data about the patient's sex or previous illnesses, or whether they have diabetes or not, or something like that?
We collect this data, of course. That
these are the confounding variables, maybe, maybe age or sex, or whether they have diabetes or not, or I don't know, maybe your supervisor or other doctors, maybe they can help with that.